My name is Claire Postel, and I am a psychotherapist and certified sex therapist. And today we are going to talk about sexual health changes to expect with your prostatectomy. The most common sexual concern is erectile dysfunction following your prostatectomy. 100% of our patients will experience some amount of erectile dysfunction. These changes will be changes in stiffness, and so this can vary. So let's say you're going into surgery with maybe you're getting a 10 out of 10 in stiffness with your erection, and maybe you're coming out of it with maybe a 3 or no erection at all. This is very common. Other changes you might experience might be getting an erection or maintaining an erection. So let's say you're able to get an erection, but you might not be able to maintain it as long as you maybe previously were able to. And this is a completely normal change. So what we know about erections is that they have two kind of working components. One is psychological and one is physical. So things that impact the physical side of erections are surgery and medications. So we know that your prostatectomy is going to impact this. And also some of the medications you might be on can impact erections. But then there's a psychological component. So changes in your sexual self-esteem or feelings of masculinity can also impact your erection. Another change you will experience following your prostatectomy is you will no longer ejaculate. This happens because the prostate is removed. So a lot of times we have patients who think, okay, if I'm no longer ejaculating, do I not experience an orgasm anymore? No, you can still experience an orgasm, but nothing will come out. Incontinence is another concern. I know you're thinking, incontinence isn't a sexual concern, but it does actually play a role during sexual activity. So we find that some people, when they get erections, they might have some stress leakage because those pelvic floor muscles are tightening. And that bothers some people, but there are some things that we can do to help with that. Lastly, some people experience strain with intimacy with their partner. They're experiencing these sexual changes, and it often impacts their relationship with their partner. This is very common. So we often find that partners will enable some amount of avoidance of sexual activity because maybe they're feeling insecure or don't know how your body's going to work. Or you're avoiding some of it because you have some new changes that are happening. This is okay, but we need to be able to talk to our partner about it. But very normal. You could click the link on your screen to learn more about relationship changes following your prostatectomy. So I know what you're thinking. These are a lot of changes following your prostatectomy, and they are. But there's some things you can be doing to help with this. One would be to focus on sexual activity that doesn't require erections with your partner. So really the only thing we need erections for is penetration. So try to explore other types of sexual touch. Second, stay consistent with your penile rehab. See the link on your screen to learn more about our penile rehab program. Some things you can be doing to address the incontinence changes that you might experience following your prostatectomy would be to take a shower ahead of sexual activity to clean yourself off and try to empty your bladder completely. This will minimize the amount of leaking that you have during a sexual encounter. Another thing to do would be to put a towel down if you're worried about leaking on your bed or your comforter. Lastly, you could use condoms to help catch some of the urine that is leaked during sexual activity. Communication is the #1 way to address some of these sexual concerns and changes. So we need to be talking to our partner all the time. We need to be talking to our partner about our concerns, our needs, and some of the physical changes we're experiencing. So let's say you and your partner don't have the best communication now. Your prostatectomy probably isn't going to improve that. And so something you can also do is to seek counseling. Go to sex therapy or couples counseling to help with this.